Welcome, everyone. Thank you for joining us. This is the Self-Advocacy for Survival, Disabled Students' Mental Health Access, and Parity in Higher Education. I'm Jay, I'm your technical guy, and I'll be here throughout the meeting to help out. Uh, During the presentation, you may ask questions at any time by using the Q&A button at the bottom of your screen. There's also a chat button that you may use to communicate with presenters and attendees, and that's similar to a discussion board. Now, when sending a chat, you have the option by using a drop down in the to field of the chat panel to send send a chat just to the presenters or to panelists and all attendees. You'd use that if you want everyone to see your message. Now, presenters will respond to questions in the Q&A box, so be sure to put your questions there. And if you need assistance at any time, also please use the Q&A box for that. Thank you, and now I'll turn it over to today's presenters to get started. And what I'd like you to do as soon as I stop sharing is turn your cameras and mics on, and then you can share your screens.
Do we want to start or do we want to wait for a couple more people first?
Okay, Lydia is here.
If you need help, just let me know.
I think we first need to promote Lydia to the panelists.
Yeah, Kiana, your audio is very, very low. I suggest you get as close as possible to wherever your microphone is and speak up. Thanks. Is anybody going to be screen sharing in this program today with the PowerPoint slide?
Jay, could you promote Lydia to a panelist, please?
Just noticed Lydia was in the attendee list, so that's been taken care of. Lydia, you can start your microphone and camera and share.
Hi, this is Lydia. Jess will be with us in just a moment, but we can get started or we can wait another minute, whatever you all would prefer. I think we see people just trickling in too, so maybe we should just give it a second as folks are joining. Going to share our opening note. Hi, and welcome. We are so glad that you have all joined us today. Before we begin, I would like to offer an invitation to you to use the space that you are in whatever way you need or prefer. The image that you see on this slide shows silhouettes of people who are sitting, lying, and moving in many different ways. Some have mobility equipment, some do not. One has a service dog. The text invites you to use the space that you are in to be as comfortable as you need to be. Feel free to move inside or outside if it's comfortable weather where you are. Feel free to have your doggos or kitties with you. If you have children, partners, or family that you like and you would like them to be around, they are welcome to be present, or, shut out if you have a way of shutting them out and you'd prefer to be alone. This is a reminder to grab something to eat or drink if you haven't done so yet. And it is also a chance for you to check where you are sitting if you would prefer to be somewhere more comfortable. We don't see your camera, so it literally does not matter if you are on a couch or a bed or whatever else would feel best for your body. This is a moment for us to pause and ground and listen to what our body minds are telling us about where we are and where we are at. Today's presentation We'll explore the topic of mental health for students with disabilities in undergraduate and graduate programs and what different self-advocates with disabilities have done on their own as student advocates, as graduate instructors, and in other ways to advocate for better access to mental health support and for environments that are more supportive of students. With me today, I have 4 excellent colleagues. But before I introduce them, I wanted to briefly share with you a couple of basic pieces of context and information about where disabled students are often coming from, including students with developmental disabilities, students with psychiatric disabilities, students with both, students with physical and sensory and mobility disabilities, and students who have acquired disabilities or chronic illnesses. Across disabilities, students with disabilities are more likely to be questioning or coming out as transgender, non-binary, or genderqueer. There are some statistics about this, particularly in relation to autism. Students with disabilities are more likely to be profiled as scary, dangerous, or threatening, even if we are the ones who've been targeted by bullying. I had my own experience with that when I was in high school. I was actually falsely accused of planning a school shooting, which was not fun. 0 out of 10, do not recommend. Students with disabilities are more likely to experience all forms of bullying, harassment, abuse, and ostracization from other classmates, from professors, and from staff at their schools. Students with disabilities are more likely to be or become unemployed, underemployed, or precariously employed. And students with disabilities are more likely to be homeless or have unstable housing. As many as 65% of all homeless people might be autistic, according to a study from a few years ago. And according to another study that came out of Switzerland in the last couple of years, people who are autistic specifically actually are more likely to be unemployed with every subsequent level of educational attainment, which means that students with disabilities have a massive uphill battle to climb. Students with disabilities are significantly more likely to be targeted for sexual harassment and sexual assault. The rate is that people with developmental disabilities are 7 times more likely to be sexually assaulted than students who do not have any disabilities at all. People with disabilities are more likely to struggle with new impairments and challenges than when they were in school age. And if they are leaving college, they're leaving education, they will be more likely to struggle with new impairments after they have left college than before or while they were in it. And students with disabilities are more likely to be unidentified accurately as disabled if they are negatively racialized, that is, if they're people of color, or if they're a minoritized gender, which is women, whether trans or cis women, and transgender people, no matter what other specific gender they might have. We are less likely to be unidentified accurately with the correct disabilities. We are also more likely, if we have one disability, to be disabled, neurodivergent, chronically ill, or have mental illness in multiple ways, in more than one. For example, in the autistic community, it's very common for autistic people to have ADD, depression, OCD, Ehlers-Danlos syndrome, or epilepsy, just to name a few. And lastly, people with disabilities are more likely to be survivors of trauma and abuse of all types, including financial, sexual, physical, emotional, and spiritual. So that backdrop helps us to understand the situation for students with disabilities, access to mental health and need for mental health once they reach college or graduate school. But enough from me. You are here primarily to hear from 4 fantastic advocates who I'm proud to all call friends of mine. We have Elayne Otstot, who recently graduated from the University of Texas at Arlington. And we have Jess Cowing, who also recently finished a PhD at William & Mary. Kenna Chic, who recently graduated from Georgetown, and Kenna and Elayne were both part of the Coella Center for Disability Law, Policy, and Innovation program at Loyola. And Natalia Rivera, who is at the University of Pittsburgh and is a Mellon predoctoral fellow now. And so each of the 4 folks who are with us today are doing different work in disability, both as students and no longer as students. But I will not spend too much more time of myself speaking about them. And I'm instead going to turn it back over to each of our panelists. I will stop this screen share. And my very first question for them is if they would each talk a little bit about the work that they are doing or have done when they were students on disability and mental health advocacy. And why don't we start with Kenna?
Hi, everyone. Can you all hear me okay? Nods. All right, great. So my name is Kenna. Thank you for the lovely introduction, Lydia. That was very helpful in terms of grounding this conversation. As Lydia mentioned, I recently graduated from Georgetown University. During my time then, I was actually the student body vice president, where I worked on a lot of projects relating to mental health, one of which that I want to talk about today is the Student Mental Health Fund. Specifically, while I was a student, I noticed that in terms of just going to therapy in DC was extremely expensive for a lot of students. A lot of students tried to go to therapy on campus, but that created issues in terms of the number of sessions that students were able to attend at a low cost. And as such, most people were referred off campus to resources that they couldn't really afford. I've had a lot of friends who took medical leave or just dropped out simply because their mental health got to a point where they really couldn't continue pursuing their education, and the university wasn't really helpful in terms of offering them the resources that could have allowed them to be successful in that environment. As such, we founded the Student Mental Health Fund, which is a fund that actually subsidizes the cost for students who are seeking therapy off campus. This fund really started small and took a lot of advocacy in terms of, convincing administrators and also working to mobilize students. But I'm very happy to announce that it still exists today at Georgetown. And so students at Georgetown who could not afford to otherwise go to therapy and receive the supports they need now can through the use of the fund. Another project that I worked on while I was a student is Project Lighthouse. I served as the president of Project Lighthouse, which is an anonymous peer support chat line that allows students to talk to trained peer supporters that are also Georgetown students in order to learn more about resources that exist on campus, but also just address some issues around loneliness or just talk about any topics that come into mind, such as academic stress or roommate problems or a newly diagnosed mental illness. And these were just projects that I've done to really ensure that whereas the university may not have had the resources to directly support students in ways that would have been beneficial to their success at college, we as students could also do work to bring that forward. So I'm very happy and excited to talk to you all more about that today.
Great, thank you, Kenna. Natalia?
Yes, hello. Hello, everybody. Can everybody hear me? Our audio's working great. Awesome. So it's a pleasure to be here with everyone, and of course with my wonderful co-panelist who I've had the privilege of speaking with in another context. So yes, a little bit about what I'm currently doing more concretely in my current capacity as a PhD candidate. So my dissertation focuses on jurisprudential, literary, and medical impressions or clinical impressions of disabilities in Puerto Rico. So sort of spanning early 20th century, the establishment of the mental asylum in Old San Juan. So basically sort of kind of tracing that trajectory, that historical trajectory, and going into sort of the contemporary examples of representations of disabilities, particularly of neuropsychiatric or neurological or neurodevelopmental variety. Basically what I'm hoping to do with my dissertation, besides sort of viewing the dissertation process as elaborating a kind of a blueprint for an emancipatory pedagogy, right? This is sort of like the theoretical basis for rendering tangible my approach to inclusive pedagogy. I also see it as an opportunity to elaborate the ways in which literature itself and literary appraisals and humanistic appraisals of disability can actually allow for advocating for interdisciplinary approaches to treatment for compound disabilities, usually, especially when they're involving trauma-based disorders that oftentimes have multiple origins, like complex PTSD or something like that. So what I'm trying to propose with my dissertation is that a humanistic reading of disability is critical, not only for understanding culturally based nuances and attitudinal hostilities directed to persons with disabilities, but also understanding the ways in which multiply marginalized subjects, like racialized subjects or gendered subjects, are actually exposed to what we call iatrogenic harm or medical harm based on incorrect treatments or because of negative racialization, like Lydia had underscored previously. So that's what I'm doing in terms of my my graduate work, and I think at least less tangibly, I am currently involved in a diversity committee where I'm incorporating some language on disability justice and inclusion. And hopefully in the future, we'll be able to offer a workshop for graduate instructors on recognizing ableism in higher education. So that's basically what I'm doing, in my current capacity as a graduate student.
Great. And thank you so much for sharing that, Natalia. Elayne, would you be able to talk about the advocacy work that you've been doing?
Yeah, sure. So I served as an undergraduate at UT Arlington for 2 years, representing the Office of Students with Disabilities. I ended up in the position because I'm sitting there as a public health student thinking, what can I do to build my resume? And the email came through in my student inbox and I responded. So I ended up in that position for 2 years, representing the Office of Students with Disabilities to basically the student government. They had a program that was called President's Roundtable, which was a once a month meeting during the semester where various organizations would come and air their grievances, air their needs, and we would vote on things that we thought that the student body found necessary or important. And during my time there, I advocated for better funding for psychological services that honestly, it's something everybody can benefit from, disabled or not disabled. It's a good thing. And then better transportation for students with disabilities, because I had run into an issue where the bus used to get around campus, because it's a pretty big campus, dumped me out, a couple of blocks from my parking spot and said, well, you're on your own now. So that's most of what I've been doing. More recently, I was working with the Disability and Abuse Project and assisting with their newsfeed curation.
Great, thanks so much. And Jess?
Hi, thanks so much for asking me to be on this panel. Happy to be here today. So as Lydia mentioned, I recently finished my PhD at William and Mary. I work in the areas of 19th and 20th century literary studies, settler colonialism, and critical disability studies. So I've done some research on narratives and experiences of Native women and youth related to assimilation. And so recently, in terms of advocacy, well, I should say I do consider scholarship a form of advocacy. I like to think about how advocacy can show up in different ways. So part of my dissertation research was trying to think about how ableism operates at all different levels, and specifically how we can think about how it has operated in different time periods. So thinking about assimilation and how ableism was such a part of the way that Native women and youth have been assimilated in the US. So that's one aspect of advocacy. And the other area in terms of campus advocacy, I happen to be one of probably very few people in my program studying or working in the areas of disability studies. And so I like to think about the kinds of quiet advocacy that you can do just by bringing up your topic in class, by talking to people. And that's sort of part of the work that I think about that I did at William and Mary. But some of that also took place in the classroom. And because there weren't too many people working specifically in the area of disability studies, I had the opportunity to design a upper division seminar, it was in an American Studies program, but it kind of functioned as an introduction to disability studies. and there hadn't been very many classes in that area before. So part of that class for me meant not just thinking about the topic, like how would I structure a course to introduce students to thinking about disability critically beyond identity, including identity, but also including disability as a topic in so many ways. A big part of that was the actual space of the classroom. So one thing I worked on a lot at William and Mary was talking to people about the difference between accommodations and then broader, more expansive access in the classroom, and what that can look like. So as an example, I started all of my classes. It didn't matter if it was disability studies or not, or if it was a discussion section for a 19th century American literature course. I always started just by addressing access right away, kind of noting that, the classroom, and often literally the classrooms where we were in were often inaccessible, but just acknowledging that classrooms weren't built to accommodate all kinds of people with different bodies and minds, and talking about what that meant, right? And so for me, what that meant in the classroom was bringing that up, because I think it went a long way in terms of students feeling more comfortable to talk about access, or maybe to request something, even if, if they were registered or not with student accessibility services. I found that made it an environment where people felt more comfortable bringing themselves to the classroom and then having conversations that maybe they wouldn't have had necessarily if it hadn't already been brought up. So part of the advocacy I did, I think, was just talking incessantly a lot about access and what that looks like in the classroom. So I also did some work with the Equality Lab at William and Mary. It's a digital humanities initiative that's been going for a few years. So I spent some time talking to faculty and staff and students about thinking about access in this way. So yes, it's about accommodation, but it's also just thinking broadly about how to make spaces more livable and survivable and just a little bit safer for people. So that's just a little bit of what I've done in the last few years.
Great, thank you. Elayne, I'd like to come back to you. Could you talk about what the biggest issues are that students face when they seek mental health services and support on campus?
Yeah, sure. This is Elayne. One of the things that I personally encountered was cost, honestly. I mean, UTA was great where they gave me, free visits up to a certain point, and then I had to pay for each visit, which for most of us who are students on student budgets, it's really hard to come up with that money plus other additional fees that classes incur and extracurricular activities that you're doing to be social and get involved. And if you have some sort of issue that they don't know how to handle, they refer you to somebody off campus and you ask about cost because, as a student, again, your budget is small. And they say, well, they work on a sliding scale. So that's been my personal experience. Yes, I got my start with the LD testing and the battery through my campus, but in the end, I ended up paying something like $1,500 or more here in the state of Texas to a private provider to get the rest of the testing I needed to receive accommodations.
Yeah, and cost is such a huge problem. I know that Kenna, you talked a little bit about that earlier. Would you like to share also?
Sure. Yeah, I definitely agree with this is Kenna. I definitely agree with what Elayne mentioned too, especially around gatekeeping, because in a lot of in a lot of universities, essentially the way that services operate is that in order to receive any type of academic accommodation, you would first need some type of letter or verification that, especially someone who has a non-apparent disability, to prove that they have that disability. And so for a lot of people who haven't been through that process before, it may be extremely difficult to get that, especially when you have a university structure where, especially as we're talking about mental health, that resource might not be as available to students, whether it's because it's due to cost or really, really long wait times, or just therapists who aren't exactly understanding of the student and their situation. So I would say definitely the lack of services creates a huge barrier when it comes to the way that students are able to access the resources that exist around them. And different schools operate differently in terms of how they prioritize students. Some schools may prioritize, having students who are considered, quote, most severe in terms of their mental health be the ones who receive the support, and they would refer other students out or delay, seeing them because there aren't really a lot of resources to do that. Other schools might operate in a system in which they choose to prioritize first-year students or students who have never been to therapy and refer out students who have been to therapy or who have received resources in the past, or students who are considered, quote, too severe to be able to receive support at the university and would require specialists. It's very interesting, and I think it really does depend on the school. And so it might be important, especially for anyone who's here, who's looking at different schools and considering what sort of resources exist, to really ask those questions when it comes to receiving virtual tours of the school or just learning more so about the school themselves. Because one thing as a student that I regret not doing in high school was really looking into the school more and seeing what resources existed and what types of structures they implemented when it came to students with mental health conditions. And I think the last thing I want to bring up is that the lack of services creates a situation in which students are essentially ping-ponged to different support systems. And so you would have different offices, and students may approach an office thinking, oh, it took me 10 years to admit that I may need psychiatric support. I am now at the counseling office and they're telling me I need to speak to another office, and the other office told me I need to speak to another office. And so it creates a situation in which, as people are experiencing crises, it becomes even more difficult to reach out for support. And so having one place in which students can actually receive the support they need, I think, is extremely vital for this process. Yet a lot of times universities either refer students out or to other resources, and that creates a whole different set of issues, especially when then students have to navigate insurance for the first time, and they may not be extremely aware of how that structure works, nor have parental support for some students to navigate that.
Thanks, Kenna. My next question is for Natalia. What stressors affect disabled students' mental health at colleges and universities?
Right, so this is Natalia. I'm going to try to answer this question basically from my own personal experience as a graduate student with more than one disability at this juncture, because when I was young, I received a diagnosis of attention deficit disorder and core anxiety, and now I have a functional neurological disorder, in part because of my experiences navigating the various administrative difficulties, I mean, to put that diplomatically. But basically, what I've experienced is that just the very process of navigating, disability supports, so basically my experience at the University of Pittsburgh is that there is no clear list equivalent to, say, like what the Job Accommodation Network, offers about possible accommodations that may be accessible to students with particular types of disabilities, whether they be movement-based or executive functioning-based, et cetera. Because they sort of tailor it to sort of your own individual situation, it's almost as if they're almost omitting possibilities for accommodation in that process. So they're very reluctant to give you a full set of accommodations that you may qualify for based on your particular condition. The delays when it comes to advocating for yourself. I mean, I know that I experienced a lot of difficulty requesting accommodations for my PhD comprehensive exams, which ultimately led to a panic attack, which led to my current tremors. And I think my experience, unfortunately, is more ubiquitous than I think a lot of us, are aware of, right? I think that there's sort of this idea that, disabled students aren't struggling as conspicuously, but my based on my experience trying to coordinate meetings between the department and between DRS, everybody just treats everything like a discrete process and nobody wants to interact with each other. So basically the burden falls on the student to not only navigate your graduate coursework while simultaneously teaching, undergraduate coursework, in my case, language courses in Spanish. People are not really aware or choose not to be aware, right? It's more like having to choose not to be aware because that's just an added, administrative burden for a lot of these offices. They choose not to be aware of the fact that the work of requesting accommodations, that burden falls first and foremost on the student, and you are held accountable, right? When your attempts at requesting accommodations don't go through, right? There's a lack of accountability. What I've noticed, there's 15 more minutes, 15 minutes remaining. So, right. So, and I think just in general, it's navigating, just disability resources that are not set up, right, to deal with things like trauma and mental health that are actually part and parcel of the process of requesting accommodations. So that's what I would have to say about that. That's, for me, that's been my experience. Just navigating those administrative burdens can contribute to mental health issues in undergrad and graduate school as well.
Thanks so much for sharing that, Natalia. Kenna, could you speak very briefly to that as well?
I just spoke. I think it might be Elayne's turn.
Well, I did want to move.
Oh,
to
for this question.
Too. Yeah.
Okay, sure. Yeah, I can actually answer this. I would say in terms of stressors, I think college is already an extremely stressful environment, like Natalia had mentioned. And so this is also the age where, especially when we're talking about psychiatric disabilities, a lot of them start developing and coming up for the first time. So you have students who are already thrown in an environment where they have to, achieve and appear to be perfect. And, at least at my school, it was very, very heightened to have that busyness culture where everyone was doing everything and everyone appeared perfect and no one asked for help. So you add that environment and then you create sort of the, biological factors of this is the kind of the age when people start developing mental health issues, plus having issues around independence. So a lot of people find themselves being independent for the first time. And so that might be scary to navigate, while other students may be navigating in environments going to college where they are actually taken out of, a dysfunctional or abusive environment that they came from in the first place. And for the first time, having the time to reconcile with what that means. And, through interacting with different students, recognizing that their upbringing may not have been the most conducive to their success. And so a lot of these factors really then create an issue in which students essentially are not having good mental health and may want help, but then there aren't a lot of resources to then really support students around that. And so it really creates a situation in which there already are huge problems and there is high demand for mental health services, but there isn't really a supply of therapists that are able to support students as they navigate this. And obviously in some cases, even having a therapist may not be the best solution, but especially when it comes to academic accommodations and gatekeeping, that creates a situation in which students who may have required additional support to get through their classes, whether it's flexible schedules or, going on meds for the first time and navigating around that, it creates a lot of difficulties for these students to actually be in a place where they're supported while they're doing that. And so a lot of students are, essentially put in a place where they have no support and they are left on their own to do it. And so, the question I ask myself, as an advocate is what can we do collectively to support students? Because a lot of, meetings I have with administrators, we always hear the answer that, this isn't just, the school that you're at, this is actually, what's happening all over the country in different countries as well when it comes to students receiving support. And so my question always is, how do we then all band together to create an environment and to make asks around making specific changes around universities and how they approach mental health?
Great. I have one more like kind of background question, and then I know as we have limited time, I want to get your feedback about what can be done different. So I'm glad that you're already moving us there. Elayne, would you share some about how the COVID-19 pandemic has affected disabled people's mental health, especially related to higher ed and employment?
Yeah, sure. So this is Elayne. Basically, with COVID, and I saw a statistic just trying to find something else the other day, that 16% of the deaths in New York State were people with intellectual disabilities. And that's frightening. And because we're so isolated with the virus and, you know, all the associated basically just crap that comes with it, I think that people with disabilities are not doing well mentally health wise. And we also have this move to everything being remote, and that tailors into higher ed quite well, because they told us for years and years and years, you can't do it remote, you can't do this remote. And now everything's suddenly been retooled for remote, but at the same time, we're not getting some of this face-to-face interaction that we sometimes need. And also when seeking employment, I mean, you've looped back towards the thing with the remote, where employers also said, well, we can't do that, it's not cost effective. And now they're finding out for the first time, oh yeah, sure, we'll just schedule Zoom meetings and this and that, and it'll be great. And people with disabilities are saying, but we asked for this years ago. So I would say that the COVID pandemic has made some things possibly better for in the future. I hate saying that because it's a really unfortunate situation, but at the same time, it's proving that something that we've said for years, that if we get remote access, then it's possible for us to work, for us to go to school, for us to, you know, figure out how to live our lives to the best we possibly can.
Thanks so much. And Jess?
Yeah, I think COVID has just revealed a vast level of inequities, and I think that has shown up a lot in the way that universities switch to virtual learning. I mean, first, in several ways, but I'll just speak briefly to two that I'm thinking of. One, just in the way that it seemed disabled people and disabled students especially just weren't consulted, which still blows my mind. I'm not surprised, but it's devastating the degree to which administrators decided what was going to happen in ways that had really drastic consequences for disabled students especially. So in some ways, as Elayne just spoke to, we've seen an increase in accessibility. In some ways, people are able to access, you know, meetings or talks or events in ways that they wouldn't have necessarily been able to before. But we've also seen, especially, I'm just thinking of some viral threads on Twitter, we've seen how devastating the effects of virtual proctoring has been for disabled students specifically. Just thinking about the ways that disabled students, I mean, all students, but especially the impacts on disabled students when you have a stranger monitoring your test taking, that just adds to the stress that disabled students, especially neurodivergent students experience anyway. It just adds to that level and really targets people who, you know, can't sit still for a whole test or have other people in their lives who are moving in and out of the space. And so that the degree of surveillance that has increased because of the ways that universities are administering virtual learning, I think has had fairly devastating consequences on disabled students' mental health, definitely.
So this is Lydia. I have one last question here, but it actually gels really well with the questions we're getting from our Q&A box. So thank you to the several people who are engaging with us. Folks are asking what's the first step to become an advocate? What advice would you like, how would you like universities to understand structural ableism about mental health services? What advice would you give to a high school student? And what advice would you give to young adults considering college but feel overwhelmed? So the way that I was going to ask each of you to address this, if you could, lightning round, if each of you would give one thing you'd like universities to do or understand, one thing, I know it's hard to pick one, and one piece of advice that you'd give to other young people who are currently students or who are thinking about going into a program. So one thing that you want universities to know or do, and one thing that you would advise students. And let's start with Natalia.
Okay, all right, so from the perspective of an administrator, and I'm also saying this as an instructor as well, in your positions as administrators and instructors, be open to understanding the ways in which your own prejudices, right, affect another person's chances for, classroom accessibility. So I may have an understanding about my disability. That doesn't necessarily mean I understand, the extent of, somebody else's disability and the ways in which, a classroom environment is inaccessible in different ways to another student. So by virtue of having a disability, that does not give me a right to make assumptions about another student's experience. So from the administrative angle, what do I want to tell students who are themselves, disabled and are navigating, these inherently inaccessible spaces? Your experiences are valid. And, even if you are surrounded by people who aren't actively, attending to, the reality of your experiences, it's your right to look for help. It's easier said than done. Don't be afraid to ask for help, but there's strength in asking for help. So please know that. Thank you.
Great, thanks. Jess?
I would just say I just wish that university administrators would ask disabled people, faculty and staff and students what their experiences are and to listen to them and act accordingly. And for disabled students thinking about how to navigate higher ed, I would just say, you know yourself better than anyone, and you probably already know what works really well for you, and just lean into that. Just lean into that and do what works best for you.
Elayne?
Yeah, this is Elayne. I would say don't let people tell you that help won't do anything. I mean, I got told that. If you need help, ask for it. And I wish that universities would not make it so hard to get the help you need.
And would you also have advice for students as well?
Oh, yes, I apologize.
No problem.
Get involved where you are comfortable being involved. If that means getting involved with the students with disabilities or going and playing tabletop every Friday night so you've just got a group of buddies to hang out with and vent about your crazy week, do it. Don't let yourself get isolated.
And Kenna, last but not least.
Yes, I would say that in terms of one thing that I want the university to change is just to prioritize mental health. A lot of times universities, by their structure, are organized in order to create academic achievement, and I wish that they understood that achievement or whatever they're really doing this for is very tied to their students' mental health, and so they need to be able to prioritize that and have to be something that they put money and resources towards. In terms of advice for younger students or students navigating being a self-advocate, I would say find your people and don't do it alone. That's one thing that I learned in terms of there's always people, whether it's on the internet or at your school, who have done work in terms of changing, the support structure for themselves or just for the university in general. And so, working with those people might be a very important way to get your needs met, and also sort of give to the community if that's something you'd like to do.
Thank you so much. And I would just add as well to those last couple of questions, there are self-advocacy groups in every state. Many rural and urban areas may also have a regional or local self-advocacy group around mental health, around intellectual and developmental disabilities, or autism specifically, that students should totally connect with. And another thing too is, the person who asked, you don't have to go to college right away. The 5 of us that are here today, we all did school at very different paces and in very different paths. All 5 of us took very different paths. There's no right age. There's no rush requirement to do it. And we all move at our own pace. So with that, I want to thank you again for sharing some of your Friday afternoon with us. A big thank you to Natalia, Elayne, Kenna, and Jess, to our captioner Diana, and to the TASH team for supporting us. And you can learn more from the TASH website, and feel free to reach out to us. I will put at least my contact information in the chat, and if the others would like to share, they're welcome to. Thank you.
Thank you so much, Lydia. Thank you, all of you, for this very informative and eye-opening discussion. The chat will be open for a few more seconds, so if you need to use that, you should do it right away, because I will have to end the session in just a moment. I want to make one quick comment about what's next. The community meetup tonight is a film festival featuring the movie Hearts of Glass, so we hope you all can take advantage of that. And with that, I'm going to say good evening. This is Jay Silver, your producer. Thanks so much for joining us tonight.